Well, it's Hospice and Home Care Awareness Month in November, and joining us today, clinical supervisor with Putnam County Home Care and Hospice, we have Kathy Lucas in to talk more about it. So thanks for joining us today.
Morning. Thanks, Holly. Thanks for having me.
Okay, so when we hear hospice, I think a lot of different people think of a lot of different things, and some of it might not be correct. So let's dispel some of the myths about hospice and give us some information about it.
Yeah, so when we talk to our patients and we do talk about hospice, the first thing a lot of people think of is death is going to come sooner. And that is far from the truth. With hospice, we want to help people with whatever the condition they may be going on at that time and help manage the symptoms and keep them comfortable and home. Usually with hospice, they have to have a diagnosis of 6 months or less. But does that mean that's going to happen within that time frame? Not necessarily. So that is one of the big misconceptions is hospice equals death sooner. Another one is a lot of loved ones feel like their patient is actually giving up, and they're not necessarily giving up. They are just trying to take control back of their life and trying to, just be comfortable because they know the end is coming and they want to be able to do it the way they want to do it and not being laying in a hospital. So that is the two biggest misconceptions of hospice.
Yeah, I would think, it affects both sides of the family, as you mentioned, the patient and the caregivers, and just everyone needs supported. And I think you guys do a little bit of that, right? With home care and hospice support, both sides?
Oh, yes, definitely. So what we do is we have the support between the nurses and we have a social worker, but we also support the family because a lot of times it's the family that's having a hard time to choose and let that patient, just let them be comfortable. A lot of families think that, again, their loved one is giving up. So we're there to help every step of the way to let them understand the process of what that patient is going through from beginning to end.
Right, because it isn't comfort what everybody wants. I mean, no pain, and to make sure that they're happy and comfortable in their situation.
Absolutely. A lot of patients, when I speak to them, as a nurse practitioner in palliative care, one of the main things before they transition to hospice, they say, I don't want to die in a hospital. I want to die in my own home, surrounded by my family, and I don't want to suffer. So that's what we're there for, to let them, we're basically grant them the wish of staying home and being comfortable.
Right. So to get into the home care and hospice care, does a doctor start that up, or can families give a call and learn more and start that up for themselves?
Well, we get a lot of phone calls from families where we do a lot of education, but what they would need is a provider would need to actually order the hospice services. And again, the criteria, which the providers are aware of, is the 6 months or less diagnosis.
All right, very good. So good information and support from you guys. So if people do have questions, as you said, you can help them out because you want to myth bust kind of some of the stuff that's out there about it.
Yes, absolutely. They can call the office at any time, and there's always a provider here that can always answer their questions.
Wow, some really good stuff, Kathy. Thank you very much for sharing with us today.
Thank you.
All right, don't go away. Noon Edition continues in a moment.